When I was first diagnosed, they had given me 4 months to live because the primary tumor was the size of a cantaloupe.
I had just left camp and I was going back to school, and there was a lot of pain in my left arm. And my mom took me to the doctor. He sent us to go get an x-ray, and that's when they really knew.
Pediatric cancer is entirely different from adult cancer. It actually derives from a different cell layer in the embryo, if you will, than does adult cancer. We try never to treat kids like little adults. In fact, the bulk of my research is focused on making sure that we're treating kids as kids, particularly when it comes to new medicines. We've made incredible strides. Every decade we see an advance in our ability to cure children, such that nowadays chemotherapy cures 4 out of 5 kids of their cancer. So there's 20% of kids for whom our current therapies are failing. And for those kids, there's a lot of hope on the horizon. We can sequence their tumors and perhaps determine a driver that could be targeted by one of our new agents, or there's this whole new field of immunotherapy and the idea of harnessing one's own immune system to fight a cancer. We're hoping that we can match the child to one of the newer treatments that's the most likely to work for them. It's good for the child, it's good for the drug. If we can prove that the drug is helpful to some children, the drug will be approved for children. And so we're always trying to advance the field, but we're doing it now one patient at a time.
And when I had my surgery, I only had 65% necrosis. So they usually like it to be 80 or 90%. And that's when I ended up coming here to try to find a new treatment that would work.
I think for kids, good quality means being able to go to school, hang out with friends, have a holiday with their family, take a vacation. With Ethan, we've always had to work around the Disney cruise, the whitewater rafting. That's the kind of problem I love to have. I have a patient whom I told at age 17 had an incurable illness.
Dr. Julia Glade-Bender was my first doctor and my only doctor. We stayed together because she was always so willing and fighting. She had plan A, B, C, D, always.
And so we said, okay, let's try this new drug on a clinical trial.
I felt like I was a guinea pig, you know, trying these medicines to see how they would work with my cancer. I'm glad that I did because
lo and behold, her tumor shrank. And it was a new class of agents, multi-tyrosine kinase inhibitors. They were new on the horizon, but since then there have been several drugs in that family, and by rotating them, we have been able to keep her going with great quality. So now my 17-year-old is 29.
I'm actually getting married. Who would have thought? I didn't think I was gonna surpass these many years with this cancer, but the big day is coming. And Dr. Glade and my social worker, Karen, they were so sweet as to buy my wedding dress. And that's a lot.
I think lots of people say, when are we going to find the cure for cancer? I don't think there's going to be a cure for cancer. There are going to be a number of cures for cancer. And the goal really for research is to figure out which patient and which tumor would benefit from which therapy. I think sometimes hope gets a bad name, but frankly, I don't know how you get up in the morning without it. And so I am very hopeful, and that's why I continue to do what I do.